and សូមជម្រាបសួរនិងស្វាគមន៍មកកាន់កម្មវិធីសុខភាព Zoom Health Talk Campaign ដែលរៀបចំឡើងដោយមណ្ឌលវិទ្យាសាស្ត្រ Devalda ថ្ងៃនេះគឺជាថ្ងៃរំលឹកនិងយល់ដឹងអំពីជំងឺមហារីកនាងខ្ញុំវិជ្ជបណ្ឌិតទីណាជានាយិកានៅមណ្ឌលវិទ្យាសាស្ត្រយើងខ្ញុំមានកិត្តិយសដើម្បីអញ្ជើញវាគ្មិនពិសេសតែគាត់ជាវិជ្ជបណ្ឌិតផ្នែកជំងឺឯកទេសជំងឺមហារីកហើយនិងជំងឺគ្រាប់ឈាមគាត់ឈ្មោះវិជ្ជបណ្ឌិត Acapon គាត់ជាវិជ្ជបណ្ឌិតព្យាបាលនៅមន្ទីរពេទ្យសមត្ថវេទទីក្រុងបាងកកហើយគាត់មានបទពិសោធន៍នៅក្នុងការព្យាបាលជំងឺមហារីកនិងជំងឺគ្រាប់ឈាមនេះអស់រយៈពេលជាង11ឆ្នាំមកហើយចាអញ្ចឹងកុំឲ្យយើងបង្អង់យូរសូមជួបជាមួយនឹងវិជ្ជបណ្ឌិតទាំងអស់គ្នាចាThank you so much, Dr. Acapon, for taking this time to give us this talk about blood cancer. Can you give us a brief introduction about yourself and the years of your practicing in Bangkok, Thailand, or other countries?
Good afternoon, everyone. I'm Dr. Acapon, and I have been hematologist and stem cell transplantation for 11 years. And I have 5-year experience in field of cellular immunotherapy.
So our first question is, can you give us a just general definition of cancer? Like, what are the cancers that is most common around the world right now, and what are the things that we have to watch out for?
So, cancer definition, I think it's composed of two parts. The first one is start for abnormal expansion of abnormal cell. And the second issue, the second definition of cancer is invasion to adjacent organ or metastasis to distant organ. So these are two main components of cancer.
I see. What are the most common cases of cancer in Thailand?
Yeah, we can classify for men and women. For men, the most common cancer is lung cancer, followed by colon cancer and liver cancer. But for women, the number one is the breast cancer, and colon cancer and gynecologic cancer.
So is it common in Thailand that people having leukemia?
Yeah, I think it's not only in Thailand, but for developing country, because we know that the one risk factor for hematologic cancer is exposure to chemical, especially pesticide. So for developing country, we export a lot, we use a lot of pesticide. So it's quite common for developing country, in my opinion.
In Cambodia, we also see a number of blood cancer, or in a technical term, we call it leukemia. Can you tell us how many types of leukemia or blood cancer in general, in total?
Yeah, let's make it simple. So for blood cancer, we can classify into two big groups. The first one is leukemia, and the second one is lymphoma.
What are the difference between?
So for leukemia, I think they share same character but feel different. So for leukemia, generally we talk about the cancer cell that originate from bone marrow and then travel into the blood circulation surround body. But if we talk about the lymphoma, usually originate from the lymph node, but it's the same thing. They are white blood cell. So at some stage for lymphoma, they can travel outside lymph node, and then they can travel around the body, same as leukemia. So sometimes when we want to specify the type of this blood cancer, we look at the origination of the cancer cells from lymph node or from bone marrow.
So usually what are the causes of leukemia and what are the causes of lymphoma?
Yeah, this is a good question. So I can tell you that the major of them is happen spontaneously. Anyway, we know some certain causes. Yeah. Everyone might know that the popular causes that we know for like 60 or 70 years ago is the exposure to radiation. Yeah, we have learned a lot from Second World War. We know that the survivor from atomic bomb in Japan, few years later, they die from leukemia. So this is the one certain cause that we know, exposure to radiation. So if we expose to radiation or we have history of radiotherapy in the past, that is the one major factor for leukemia. And the second one, I already mentioned at the beginning of the talk, exposure to chemical such as pesticide or aromatic carbon there and chemotherapy. For example, if we got breast cancer and if we get chemotherapy, so 3 or 5 years later, we can develop the leukemia. In this case, we call secondary leukemia.
For the age group, the cause that is spontaneously, I saw that a few of my patients, they diagnosed leukemia or lymphoma in a very young age, around 20 plus or 30 plus. What kind of age group of the onset of the disease?
Yeah, it depends on the type of the leukemia or the lymphoma. Anyway, for leukemia, yeah, major of them, the incident, we found more incident in the patient who elder than 60 years old. But for some type of leukemia, such as acute lymphoblastic leukemia, quite common for young adult. The same as lymphoma, some type of lymphoma common for elderly, but some type common for teenage age group. Yeah.
Usually, is there any sign and symptom of the early stages of the leukemia and lymphoma?
Yeah, I want to separate both of them because the sign and symptom is different. Okay, so for leukemia, we can classify just for simple into acute leukemia and chronic leukemia. Anyway, for acute leukemia, the name is acute. It means that you might never have any abnormality. You feel fine, okay? Then one day you develop the symptoms suddenly. And the symptom of acute leukemia is a symptom of bone marrow failure. So for the red blood cell line, you're going to have symptoms from anemia. You're going to feel dizzy. You're going to feel like you don't have energy. Or you feel like when you walk upstairs, you feel, oh, I'm so tired and I need to take a rest, even just 1 or 2 stairs. Yeah. And for the symptom of the white blood cell, you're going to have infection. So for acute leukemia, you're going to have fever. This is the common symptom of the infection. Yeah. And for platelet, you're going to have abnormal bleeding, such as easy bruise, or you're going to have spontaneously bruising in your body. Yeah. This is the symptom of the acute leukemia. And for lymphoma it's quite different because you're going to have few weeks until few months to develop the symptom. Yeah. If you have enlarged lymph node, it's very easy, the symptom that you can detect by yourself. When you take a bath, you might palpate the mass or the lump at your neck, your groin, or your axilla. Or you can have symptom from the lymphoma, the chemical substance that they release into blood circulation. You're going to have fever, or you're going to have weight loss, or you're going to have lost appetite. This is a symptom of lymphoma.
Okay. So let's go back to leukemia a bit. For acute leukemia, we can see all the symptoms. What about chronic leukemia? Does it give any symptoms, or it's just silently grow inside you until one day it pop up as something critical?
Yeah, exactly. It doesn't, yeah, it's like it's a silent growth inside your body because the name is chronic. So it means that you might not have any symptom for a few years. So the best way to detect chronic leukemia is a routine physical examination. It's very important because in Thailand, in Bangkok, around 80% of chronic leukemia we diagnose when they do routine physical examination, like annually physical examination. Yeah, because at early stage, we found only elevated in number of white blood cell.
So, what are the investigations that needs to be done to detect if a person have leukemia?
So just start from the easy test that we can do is a complete blood count. If we found abnormality in red blood cell, white blood cell, and platelet, we have to do specific investigation. Mhm. So for the CBC, we can do everywhere. Yeah, it's super easy. Mhm.
So, what are the specific
So I recommend that. Yeah, the specific investigation is to do the bone marrow biopsy for leukemia because we can find the abnormality cell. At the same time, we can do genetic test to detect the abnormal mutation that happen in our stem cells. For lymphoma, after we palpate the enlarged lymph node, we have to do the lymph node biopsy because we need to do immunohistochemical staining to classify subtype of lymphoma.
So, usually, if we detect that we diagnose the patient with acute or chronic leukemia, is the treatment the same or it's different for both?
Yeah, right now in the past few years, the understanding in the causes of the disease we know more. Now we know specific at into the gene mutation. We know that we use the type of the mutation to classify the patient into the cause of the disease to specific to the mutation. And the treatment for the leukemia and the lymphoma, they're different. They are different. At the same time, for the leukemia, we know the treatment that specific for a specific type of leukemia as well. Same as lymphoma. The treatment more specific depend on the type, the mutation, yeah, in the cancer cells.
So I know that a lot of people can do bone marrow transplants. Is there any indication for bone marrow transplant if someone is fit to the transplant or someone might just need to use medication? What are the indication for that?
Yeah, so for the leukemia, if the patient are fit enough and young enough, in my opinion, if they're younger than 60 years old, younger than 60 years old, with new the transplantation method that we have used, in the past few years, we will not perform the allogeneic transplantation for patients who elder than 50 years old. But right now, with new treatment protocol, you can do transplantation for like a 60 years old if they are fit enough. And we make decision by the type of disease and the mutation. Right now, the indication for the stem cell transplantation or bone marrow transplantation, the first indication is acute leukemia, both of acute myeloid leukemia and acute lymphoblastic leukemia. And the second indication is for the lymphoma. And the other of blood cancer, multiple myeloma. And the other genetic disease like thalassemia, that's quite common in the Southeast Asia. I think the thalassemia quite common in the Cambodia as well, right?
So that
The
is
thalassemia, yeah, it's quite common. Yeah, because I I have many patients from Cambodia who get thalassemia. And the indication for transplantation is aplastic anemia. For aplastic anemia, the bone marrow transplantation is the curative treatment. And I perform allogenic transplantation for a number of Cambodia patients, and the result is very impressive. Right now, they can stop treatment and they can back to school and they can back to normal life activity. I'm very happy with the result. Yeah.
Yeah, that's great news. So if let's say the patient isn't fit to be having bone marrow transplant, so do we use chemotherapy or targeted therapy or immunotherapy for leukemia treatment instead of bone marrow transplant?
Yeah, this is a good question. So the transplantation we perform for prevention the relapse of disease. So for at the beginning, both of leukemia and lymphoma, patient need the treatment before they can proceed to do transplantation. And the type of the treatment before transplantation is depend on the type of leukemia or lymphoma and depend on the mutation. So the treatment we can combine chemotherapy or targeted therapy, yeah, or even cellular therapy before we perform transplantation. It depends on the specific type of leukemia or lymphoma.
I see.
Yeah, so usually patient gonna need 1 or 2 cycles of the treatment before we can do transplantation.
So what do you recommend for those patients who's curious or worried if they have leukemia because they are the silent part of the disease, and what would you recommend as cancer screening for the patient who's just fit and healthy?
Yeah, in my opinion, it depends on the risk factor. So if you don't have any risk factor, you can just do routine blood test like the complete blood count every 6 months or at least annually 1 time per year. But if they have risk factor, such as if they got breast cancer and they get chemotherapy, so maybe they might need to do the complete blood count test every 3 or 4 months. Yeah, so it depends on risk factor. And in my opinion, the complete blood count is very easy and you can do everywhere.
Is it related to genetic? Most cancers usually relates to genes. For example, if I have father or mother who has blood cancer, what are the percentage of the children to get it from their parents or grandparents?
Yes, for some certain type of cancer, such as breast cancer or colon cancer, we know that the inherit genetic factor, but the major causes of the leukemia or the lymphoma is acquired mutation. So they are not inherited disease. Yeah, it's acquired disease.
I think we have everything covered. At the end of the talk, because this is the World Cancer Day, do you have any message for the day to end our talk?
Yeah, you just need to do the routine physical examination. That's very important to help you diagnose at early stage of the cancer. And yeah, I know that everyone doesn't want to get cancer, but in case that you get it, early diagnosis is very important, and then you have chance to be healed. Yeah, if you delay, if you deny, then you don't have chance to be healed.
That's great. Thank you so much, Doctor, for today's talk, and I really enjoy our conversation, and I hope that we can raise up a few more topics to talk and give our patients new hopes, updated treatments, and a few investigation or screening that needs to be done. Thank you very much, Doctor. ចាដោយដែលវិជ្ជាបណ្ឌិតបានមានប្រសាសន៍អញ្ចឹងការ screening ឬក៏ការឆែកសុខភាពដើម្បីដឹងថាតើយើងមានជំងឺមហារីកឈាមឬក៏ជំងឺមហារីកអ្វីផ្សេងៗដើម្បីឲ្យយើងអាចដឹងមុនកុំឲ្យជំងឺមហារីកហ្នឹងទៅដល់ដំណាក់កាលចុងក្រោយដែលពិបាកនៅក្នុងការព្យាបាលហ្នឹងគឺវាមានសារៈសំខាន់មែនទែនចានៅមណ្ឌលវេជ្ជសាស្ត្រ Devalda យើងមានមន្ទីរពិសោធន៍ដែលសម្រាប់រាប់គ្រាប់ឈាមសម្រាប់មើលតែឈាមមួយចំនួនដែលអាចជួយស្វែងរកថាតើបុគ្គលណាម្នាក់ហ្នឹងគាត់មានជំងឺមហារីកណាមួយឬក៏អត់ហើយទន្ទឹមនឹងនេះដែរមណ្ឌលវេជ្ជសាស្ត្រ Devalda ក៏មានដៃគូសហការជាមួយនឹងវិជ្ជាបណ្ឌិតឯកទេសក៏ដូចជាមន្ទីរពេទ្យផ្សេងៗនៅក្នុងស្រុកហើយនិងក្រៅប្រទេសផងដែរដោយដែលយើងដឹងហើយថាមន្ទីរពេទ្យនិងវិជ្ជាបណ្ឌិតឯកទេសនៅក្នុងស្រុករបស់យើងហ្នឹងក៏គាត់មានបច្ចេកវិទ្យានិងគាត់មានការព្យាបាលដែលមានប្រសិទ្ធភាពជូនដល់ប្រជាពលរដ្ឋខ្មែរដែរប៉ុន្តែបើសិនជាក្នុងករណីដែលយើងមិនអាចព្យាបាលនៅប្រទេសកម្ពុជាបានមណ្ឌលវេជ្ជសាស្ត្រក៏មានដៃគូសហការជាមួយនឹងមន្ទីរពេទ្យសមត្ថវេទស្រាប់និងមន្ទីរពេទ្យឯកជននានានៅតាមប្រទេសថៃប្រទេសសិង្ហបុរីប្រទេសឥណ្ឌានិងប្រទេសផ្សេងៗទៀតផងដែរចាទន្ទឹមនឹងនេះ Devalda ក៏សហការជាមួយនឹងក្រុមហ៊ុន BAAC ដែលជាក្រុមហ៊ុនយន្តហោះនិងឡានសង្គ្រោះបន្ទាន់ដែលរៀបចំទាំងបែបបទឯកសារអ្វីទាំងអស់ជូនដល់អ្នកជំងឺដែលគាត់មានបំណងទៅព្យាបាលឬក៏ទៅពិគ្រោះជាមួយនឹងគ្រូពេទ្យតាមរយៈ tele consultation ឬក៏ទៅផ្ទាល់ផងដែរចាជាចុងក្រោយនេះក្នុងឱកាសថ្ងៃរំលឹកនិងយល់ដឹងអំពីជំងឺមហារីកនាងខ្ញុំជាវិជ្ជាបណ្ឌិតនៅប្រទេសកម្ពុជាក៏សូមគាំទ្រនិងលើកទឹកចិត្តយ៉ាងពេញទំហឹងចំពោះក្រុមអ្នកជំងឺដែលគាត់កំពុងតែពិបាកនៅក្នុងការព្យាបាលជំងឺមហារីកគាត់តស៊ូខិតខំប្រឹងប្រែងដើម្បីគោរពតាមការព្យាបាលនិងវិជ្ជាបញ្ជារបស់វិជ្ជាបណ្ឌិតឯកទេសហើយក្រុមគ្រូពេទ្យនៅក្នុងសកលលោកគឺកំពុងតែធ្វើខិតខំស្រាវជ្រាវរកថ្នាំថ្មីៗហើយនិងថ្នាំវិធីសាស្ត្រក្នុងការព្យាបាលជាច្រើនដើម្បីជួយទៅដល់អ្នកជំងឺមហារីកគ្រប់គ្នាចា៎ខ្ញុំវីណាពីមណ្ឌលវេជ្ជសាស្ត្រ Devalda សូមអរគុណសូមជម្រាបលា